Hey everyone, ready to dive into the future of diabetes tech with us?
Always.
Great. Today we're taking a deep dive into some fascinating guidelines. The American Diabetes Association's Standards of Care in Diabetes 2025.
These standards of care are like a roadmap for diabetes care.
Exactly. And we're focusing specifically on Section 7, all about diabetes technology. It's going to be an exciting journey.
Definitely. Lots to unpack.
So, right off the bat, the ADA makes a pretty strong statement. They recommend that diabetes devices should actually be offered to everyone with diabetes.
It's a big deal. Not just considered, but offered. A shift in how we view these tools.
I agree. So not just something you might get if things aren't going well, but something that could benefit everyone from the get-go.
Right. And they're putting a special emphasis on continuous glucose monitoring, or CGM.
Oh yes, CGM's getting a lot of attention lately.
For good reason. The ADA suggests offering CGM early in the diagnosis of type 1 diabetes.
Wow, that's interesting. Thinking about it, early intervention can make a huge difference.
It can. Studies show that when young people with type 1 start using CGM early, they often see lower A1C levels.
That makes sense. And happier parents too, right?
Exactly. Parents feel more confident and involved in their child's care.
I bet. But I'm glad the ADA isn't saying, hey, everyone needs tech no matter what. They also stress that device choices should be tailored to each person.
Oh, absolutely. Individual needs and preferences are key. What works for one person might not work for another.
Makes sense.
And the ADA remembers caregivers in this too.
Oh, that's so important. Recognizing that caregivers have needs too.
Yeah, managing diabetes isn't a solo mission. It often takes a team effort.
I like that, a team effort. And on the topic of support, the ADA emphasizes education and training.
Couldn't agree more. Having the tech is one thing, but knowing how to use it effectively is another.
You can't just hand someone a complex gadget and expect them to figure it out on their own.
Exactly. Ongoing support for both the person with diabetes and their healthcare team is so important.
Okay, let's get into some specifics. First up, blood glucose monitoring, the good old BGM.
Ah, yes, the classic finger prick. Still a cornerstone of diabetes management.
I know some people might think BGM is kind of outdated with all of the excitement around CGM, but the ADA says, hold on, BGM is still essential.
It is. Think of it this way. BGM is like checking your temperature. It tells you what's happening right now.
A snapshot of your blood sugar level.
Exactly. While CGM is more like wearing a fitness tracker, it shows you trends and patterns over time.
So they work together, providing different but valuable pieces of the puzzle.
They do. And the ADA provides specific recommendations for how often to check your blood sugar with BGM. Before meals, at bedtime, anytime you suspect you might be low.
Pretty standard stuff, but good to be reminded.
It is. And for people with type 1, there's some interesting research. Studies have shown that checking more frequently is actually linked to lower A1C levels.
Really? So those finger pricks really do pay off.
They do.
All right, message received. Don't ditch the meter just yet.
Not just yet. Now let's talk about the tech that's been making waves. Continuous glucose monitoring, or CGM.
Okay, CGM time. It feels like everyone's talking about it.
And for good reason. Imagine having a backstage pass to your blood sugar. Instead of just glimpses, you see the whole show.
I like that analogy. You get to see how your blood sugar responds to everything you do.
Exactly. And the ADA is fully on board. They recommend CGM for both type 1 and type 2 diabetes, especially for people on insulin therapy.
So it's becoming more mainstream, not just for those struggling with really tight control.
It's a valuable tool for anyone who wants deeper insights into their blood sugar patterns.
And the research is pretty convincing, right?
Oh, yeah, it is. Studies have shown that CGM can lead to lower A1C levels.
That's great. What else?
Well, CGM has also been shown to reduce those scary low blood sugar episodes, hypoglycemia, and helps people spend more time in that sweet spot where their blood sugar is just right, time and range.
So CGM is not just about avoiding the highs and lows, but about feeling your best more consistently.
Exactly. More time feeling good, more energy, better sleep, all that good stuff.
But what about using CGM during pregnancy? I imagine that could be tricky.
You're right, pregnancy is a unique situation. But there's good news.
Oh.
The ADA says CGM is now approved for use during pregnancy.
That's fantastic. And are there specific devices for expecting mothers?
There are, and the research is really promising. Studies show that using CGM during pregnancy not only helps the mother's A1C in time and range, but also leads to fewer babies being born larger than expected.
So it's potentially beneficial for both mom and baby. That's really amazing.
It is, but it's worth noting that the ADA mentions that while CGM is powerful in pregnancy, you might still need fingerstick checks sometimes.
Yeah, just to double check and be extra safe.
Exactly. Okay, so we've talked about monitoring blood sugar. Now let's shift gears to insulin delivery.
All right, this is where things get really interesting with so many options available now.
Yeah, but let's start with the basics, insulin syringes and pens.
The old reliables.
They are. The ADA actually states a preference for insulin pens over syringes for most people on MDI, multiple daily injections.
But they do say to consider individual needs.
Of course.
Some people might still prefer syringes, and that's okay.
Absolutely. And the ADA points out that pens can be especially helpful for people with dexterity issues or vision impairment.
It's all about making insulin delivery as user-friendly as possible.
Exactly. And speaking of making things easier, you know what else is cool?
Tell me.
There are now these connected insulin pens that can record doses, sync with your CGM, and all that.
Whoa, so they're like smart pens.
They are. They take a lot of the guesswork out of insulin dosing.
That sounds pretty amazing.
It is. And the ADA also mentions using FDA-approved bolus calculators to help figure out insulin doses.
Like a little math helper for diabetes.
Exactly. But, speaking of game changers, let's talk about insulin pumps and those automated insulin delivery systems.
The aid systems. It feels like they're straight out of the future.
They kind of are. Imagine waking up most mornings with your blood sugar already in range. That's the reality for a lot of people using aid systems.
Wow, no more waking up to those high blood sugar surprises. Sign me up.
Right. And the ADA is recommending aid systems as the preferred method of insulin delivery for youth and adults with type 1 who can use them safely.
They're putting a lot of weight behind this technology.
They are. They recognize how life-changing these systems can be.
So how do they work? What makes them so special?
They're like having a mini pancreas on board. They constantly monitor your glucose and adjust your insulin to keep you in range.
So they take over a lot of the work of managing diabetes.
They do. And the research on aid systems is pretty remarkable. They've been shown to improve A1C, time in range, and reduce those scary low blood sugar events.
So it's not just hype. There's real science behind it.
There is. And the ADA highlights that these systems should also be offered to people with type 2 diabetes on MDI if they can use them safely.
That's great. It's about expanding access to these tools for everyone who could benefit. Now, you mentioned something earlier that I'm dying to hear more about. Open source automated insulin dosing, or OS aid.
Oh yeah, OS aid. It's pretty cool stuff.
Tell me everything.
Think of it like the DIY version of those automated systems. They're designed and maintained by people with diabetes and their families.
Wow, that's incredible. They're taking things into their own hands.
They are. And the ADA even acknowledges these systems, recommending that healthcare professionals provide support to those who choose to use them.
I like that. It shows they're willing to embrace innovation, even if it's coming from outside the traditional medical world.
It does. Okay, before we move on, can we circle back to those aid systems for a moment?
Sure, what about them?
I'm especially curious about their use during pregnancy.
It seems like that could present some unique challenges, right?
It does. Pregnancy brings a whole other level of complexity to diabetes management. Lots of hormonal changes and shifting insulin needs.
So those aid systems might not be as straightforward to use during pregnancy.
Right. They're not a simple set it and forget it solution in this case.
I see.
And the ADA points out that right now, commercial systems don't have glucose targets designed specifically for pregnancy.
Oh, that makes sense. Pregnancy requires really specific glucose goals.
It does. But there's encouraging research emerging. The ADA mentions a study where pregnant women with type 1 using an aid system spent more time in their pregnancy-specific target range.
That's great. So there's hope that these systems can be adapted for pregnancy safely and effectively.
Definitely something to watch.
It is. Okay, I think we've covered a lot of ground on insulin delivery. Should we move on to another exciting area of diabetes tech?
Absolutely. Let's talk about all those digital health tools.
Apps, online programs, all those things that connect us to information and support.
Yep, all that. It's a rapidly growing field with so much potential for empowering people with diabetes.
And the ADA seems to agree. They specifically recommend combining things like CGM or insulin pumps with online or virtual coaching.
They do. They see the value in a holistic approach.
Yeah, using tech to create a truly personalized experience.
Exactly. And there are even FDA-approved digital therapeutics now. Apps clinically validated to treat medical conditions, including diabetes.
Whoa, wait. So apps that actually function as treatments?
They do. Pretty cool, right?
That's amazing.
Yeah.
With all this digital stuff, we need to be careful about data privacy, right?
Absolutely. The ADA touches on this, emphasizing the importance of choosing apps that prioritize data protection.
It's crucial to be aware of how our data is being used.
Yeah.
And to trust the companies we're sharing it with.
You got it. Now, what happens to all this fancy tech when you're in the hospital?
Good question. Does it all get left at the door?
Not necessarily. The ADA has recommendations for inpatient care, too.
Oh, interesting. What do they say?
Well, they suggest continuing CGM use in the hospital when appropriate, with finger sticks to confirm readings for insulin dosing.
So bridging the gap between outpatient and inpatient care.
Exactly. And they also recommend continuing insulin pump or aid system use if appropriate protocols and support are in place.
So minimizing disruptions to your diabetes management. Makes sense.
It does. And there's a fascinating detail. You know the COVID-19 pandemic?
Yeah.
Well, it actually spurred an increase in CGM use in hospitals
Really? Why is that?
to reduce contact between healthcare workers and patients.
That makes sense.
And while there are challenges, research on using aid systems in hospitals is
This-
also emerging.
This whole field is constantly evolving. It's incredible.
It is.
Okay, I think we've covered a ton of information in this first part of our deep dive. My brain is buzzing.
What do you
Say we take a quick break, come back refreshed, and dive into even more insights.
Sounds like a plan. I'm ready for more. It's amazing to think about all this tech and how it's really about giving you more control.
Yeah. It's about feeling empowered to manage your diabetes and live your life to the fullest.
Exactly. But, I get it. It can feel overwhelming at times.
Oh, yeah. So much information, so many options. It's easy to get lost in it all.
That's where having a good relationship with your healthcare team is key.
I totally agree. Your doctor, your nurse, your diabetes educator, they're like your diabetes tech support team.
I love that your diabetes tech support.
They can help you sift through everything, figure out what's right for you, troubleshoot any issues.
Couldn't have said it better myself. It's a true partnership. And remember, there's no need to jump on every new trend.
Yeah, you don't have to have the latest and greatest gadget to manage your diabetes well.
Exactly. It's about finding what fits your needs and your life.
I remember we talked earlier about how CGM provides a ton of data about your blood sugar patterns.
It does. It's like having a detailed map of your glucose journey throughout the day.
But sometimes, even with a good map, you need someone to help you interpret it.
Oh, yeah. Especially when it's as complex as our blood sugar data.
Right. So many ups and downs, twists and turns.
The ADA suggests using what they call standardized reports to make sense of it all.
So it's like having a translator for your CGM data.
I like that, translator. And these reports can be really helpful for seeing patterns. Maybe you're consistently high after certain meals, or your blood sugar drops a lot overnight.
So you can pinpoint those areas where you might need to make some changes.
Exactly, like adjusting your insulin doses, tweaking your meals, trying a different type of exercise.
It's about using that data to empower yourself.
Exactly, empowering yourself to make informed decisions. Speaking of, can we circle back to something we touched on before, access to diabetes technology?
Oh, absolutely. It's a huge issue.
The ADA is very clear that access shouldn't be based on things like age or your A1C level.
Everyone who could benefit should have the opportunity to use these technologies.
And they even say that insurance providers should continue to cover CGM, insulin pumps, and aid systems for people already using them.
It's about recognizing that this tech can be truly life-changing, not just a nice-to-have.
It is. And on a larger scale, it's about advocating for policies that ensure equitable access for everyone with diabetes.
We've talked a lot about the physical benefits of all this technology.
Yeah.
But I think it's important to acknowledge the psychological impact as well. Diabetes is a tough condition to live with.
Oh, absolutely. It can be a real emotional roller coaster.
I can only imagine. I feel like using technology like CGM could provide a lot of peace of mind.
It can. Knowing that you'll get an alert if your blood sugar starts to go too high or too low can reduce anxiety and stress.
Right, like having a safety net.
Exactly. And those aid systems, well, they can help lighten the mental load too.
Oh, I see. By automating some of the tasks, like calculating insulin doses.
Yeah, you don't have to be constantly thinking about your diabetes, making decisions, worrying about making mistakes.
It frees up mental space for other things.
Exactly. But, there's a flip side to all this too.
What do you mean?
Well, some people might find that relying so much on technology makes them less confident in their own ability to manage their diabetes.
That's an interesting point.
It's about finding that balance, Technology is a tool, It's there to support us, not replace our own knowledge and intuition.
I like that.
Hmm.
So it's not about becoming a robot. It's about using these tools to enhance your self-management.
Exactly. And if you're struggling with that balance, don't hesitate to reach out to your healthcare team.
They can help you navigate those feelings and find a path that works for you.
That's right.
So we've talked about the present state of diabetes tech, but what about the future? What's on the horizon? Any exciting breakthroughs?
Oh, there's a lot of cool stuff in the works. Have you heard about those closed loop systems?
Closed loop. I don't think so.
So imagine an aid system that's so advanced, it basically acts like a real pancreas.
Whoa, you mean it would automatically adjust your insulin without any input from you?
Yep. No more finger pricks, carb counting, or calculating doses.
It sounds incredible.
It does, right? It's still being researched, but it's definitely a technology to watch.
It is. Any other exciting things on the horizon?
Well, there's also a lot of research on non-invasive CGM systems.
No more needles or sensors? That would be amazing.
Right. Imagine monitoring your blood sugar with just a smartwatch or even a smartphone app.
It's like something out of a sci-fi movie.
It is. And speaking of sci-fi, you know what else is being explored?
What?
Artificial intelligence, AI, in diabetes management.
Wow. AI is everywhere these days. How could that be applied to diabetes care?
Well, picture AI algorithms analyzing all your data from your CGM, your pump, even your food logs,
Oh, I see.
and using that information to provide personalized insights and predictions.
It's like having a super smart diabetes coach in your pocket.
Exactly.
That's pretty mind-blowing.
It is. And AI could help us develop even more advanced aid systems, ones that can learn from your data and adjust on the fly.
So it's not just about new gadgets. It's about using data and AI to create a truly personalized and proactive approach.
Exactly. It's about helping people live healthier, happier lives with diabetes.
I love that.
But, as exciting as all this technology is, we need to remember it's just that a tool.
Right. And like any tool, it has its limitations.
Exactly.
And we need to be mindful of the potential downsides, like information overload, anxiety, or becoming too reliant on our devices.
You're absolutely right.
It's all about finding that balance.
It is. And if you're feeling overwhelmed or unsure, always remember to talk to your healthcare team. They can provide guidance and support.
Such an important reminder. You're not alone in this.
And remember, the diabetes community is a great resource, too. There are so many people out there willing to share their experiences and offer support.
Okay, I think we've covered a lot of ground on the present and future of diabetes tech. Where to next?
Let's wrap things up with a look at how all of this is changing the bigger picture of healthcare.
It really feels like we're on the verge of a whole new era of healthcare with all these advancements in diabetes tech.
It is a pretty exciting time to be in this field. One thing that really strikes me is how it's changing our whole approach to healthcare. We're moving away from that old reactive model.
You mean where you only see the doctor when something's already wrong?
Exactly. It's like waiting till the fire alarm's blaring before you even think about calling the fire department.
Not a great strategy.
No, not at all. But diabetes tech, those CGMs, the aid systems, they're helping us move towards a more proactive approach, preventing those fires in the first place.
I like that analogy. It's like having a smoke detector that alerts you to a problem before it gets out of control.
Exactly. You see those little changes in your blood sugar before they become big problems. And those aid systems, they can even step in and make adjustments before you even feel any symptoms.
It's like having a personal assistant for your diabetes, working behind the scenes to keep things running smoothly.
That's a great way to put it. It's about taking control and being proactive. And this shift towards proactive care, it's not limited to just diabetes. It's happening across healthcare as a whole.
That's really encouraging. It's about empowering people to manage their own health.
Absolutely. And technology is giving us the tools to make that happen.
Speaking of empowerment, the ADA seems to be really emphasizing individualized care in these standards of care.
They are, because, everyone's experience with diabetes is different. What works for one person might not work for another.
Right. There's no one-size-fits-all approach.
Nope. And the ADA gets that. They know technology is just one piece of the puzzle. It has to be tailored to your specific needs and goals.
And that's where that partnership with your healthcare team comes in, right?
Exactly. It's a team effort. Finding the right technologies, figuring out what works for you, making a plan together.
It's about using technology to support your overall diabetes care plan.
Right. And that support involves education, training, and just having someone to talk to. The ADA really emphasizes that ongoing support is crucial.
It makes sense. You need to feel comfortable and confident using these tools.
You do. And that goes for healthcare providers, too. They need the training and resources to keep up with all these advancements.
It's like we're all learning together, isn't it? Healthcare teams and people with diabetes.
We are. This whole field is constantly evolving, which is exciting, but also a little daunting.
It is. So it's really about working together, sharing information, and supporting each other. And that support needs to extend beyond the doctor's office, too.
Oh, absolutely. The ADA even mentions that schools should support students who use diabetes technology.
That's so important. Creating a supportive environment at school can make a world of difference.
It can. And the ADA goes even further. They advocate for continued insurance coverage of these technologies, across different providers, no matter your age or A1C.
So access shouldn't be a barrier for anyone who could benefit from this technology.
That's the idea. Everyone deserves the chance to live a healthier, fuller life with diabetes.
Well said. We've covered so much in this deep dive, from the current state of diabetes tech to the exciting possibilities on the horizon.
It's been quite a journey. I hope our listeners are feeling informed and empowered.
I know I am. But before we wrap up, I want to echo something you said earlier.
Sure, what's that?
Technology is amazing, but it's a tool, not a magic solution.
You got it.
We need to use it wisely. And remember that it's just one part of a holistic approach to diabetes care.
Couldn't agree more. Finding that balance between technology and our own knowledge and intuition is so important.
And if anyone out there is feeling overwhelmed, remember, your healthcare team is there to support you. Don't hesitate to reach out.
Absolutely. They're your partners in this journey. And don't forget the power of the diabetes community.
Right. There's so much support and wisdom to be found there. Connecting with others who understand what you're going through can make a world of difference.
It can. Well, I think we've done it. We've explored the vast and exciting world of diabetes technology.
It's been an incredible deep dive. Thanks for joining us on this journey of discovery, everyone. We hope you learned something new and feel inspired to embrace the power of technology to transform your diabetes management.
Absolutely. And remember, the future of diabetes care is bright, and together we can make it even brighter.
Until next time, stay curious, stay informed, and keep those knowledge-seeking fires burning.